the Wendy K Show. And today on the show, I have one of the hottest guests, the best hormone promoting herself as the most important hormone in the body, progesterone. Hello.
Good, how are you, Wendy? Thank you for having me.
Please, have a seat, have a seat. Can you all just give a quick warm welcome? Oh, beautiful.
Such a great audience. Oh my God. Thank you. Thank you, everyone. Thank you.
They want to stop?
Thank you. Yes, Wendy, and I am secreted by the mother of all organs, the ovaries. No pun intended. Not only that, but I also aid in transition of the endometrium from the proliferative to the secretory phase, along with preparation of the endometrium for potential implantation. You know, helping release oocytes and all that.
Yes, yes.
Pretty important stuff to get life going.
I would
you
say
know?
so. I would.
Not only do I get it going, but I help to maintain it. By this, I mean maintain pregnancy.
Oh, wow.
Even after the baby is born, I am still very much needed and important. I stimulate the development of lobuli and mammary ducts in breast tissue. High levels of progesterone, me, during pregnancy serve to prepare the mammary glands for lactation. Baby has to eat, right?
Oh, absolutely right. I know I certainly need to eat a good meal every now and then. It says here you also induce breast development and regulate the menstrual cycle. So progesterone, besides doing all these wonderful things, preparing the uterus for pregnancy by thickening that uterine lining, creating an ideal environment for a potential fetus, the word is also you affect other important tissues such as, I don't know, the brain.
That's exactly right, Wendy. Me and the brain, we go way back.
Oh, wow.
Being the most important hormone that I am, it is my job to help expand work to other tissues. For the brain, I mediate sexual responsiveness. I have a direct effect on the neurotransmitter receptors called gamma-aminobutyric acid type A, GABA receptors.
Oh, wow.
When my levels drop, a woman can experience withdrawals similar to that seen with benzodiazepines. This is the cause of postpartum depression.
Well, I did not know that. How it was just like a withdrawal from a drug. That's crazy.
Yeah.
You seem pretty important. Am I right, people? Am I correct here?
Thank you. Thank you.
Thank you so much. So great. So awesome. So progesterone, far and wide. People are crazy about you. They're nuts. They love you. They do all these things. You seem to be everyone's favorite female sex hormone, and this is even true for men. After all, you exist in small amounts in men for sperm development, and you are a precursor for testosterone. That's awesome. So I was wondering what some viewers on the street think about you, progesterone, and some of their opinions.
I'd love to know.
Let's go take some questions from the street.
Hey, yo, progesterone. Yo, you want to tell me a little bit more about yourself?
Well, thank you so much for your great question. I would describe myself like anybody else, a steroid with 21 carbon atoms. I'm produced in syncytiotrophoblasts in the human body, and I'm also luteinized in granulosa cells of the ovarian follicles, as well as cortical fascicles and the retinal area of the adrenal cortex.
I love your show. And I love you, progesterone. My question is, how do you affect bone in the human body?
That's an excellent question. I not only regulate bone mass, but I also take measures to prevent bone mass loss too.
Hi, can you tell me more about your effect on the brain?
Of course, like I told you, me and the brain, we go way back. Me and my posse of metabolites, as mentioned before, affect the neurotransmitters GABA. These receptors are affected by me and my posse, and we are able to reduce anxiety and induce relaxation. Makes sense why low levels of me can cause depression in women.
Wow. That was great. That was amazing.
Such great viewers.
I always love to hear what people have to say from the street when they can't make it to a live studio audience. So viewers in the street, they're loving you, and it's also saying here, you have a film out.
Yeah.
Wow.
Everywhere.
You have a film.
Yeah.
We actually have a clip of that film.
Really?
We can show to you, sneak peek, only here on the Wendy K Show. Can we get that rolling, please?
Oh, wow.
Oh, is it off?
A series of events called the menstrual cycle happens about once every month to prepare a woman's body for pregnancy. Changing levels of natural chemicals in the bloodstream, called hormones, control these events. The reproductive organs affected by these hormones include the vagina, cervix, uterus, fallopian tubes, and ovaries. The ovaries produce two main hormones called estrogen and progesterone. As the level of estrogen begins to rise, it causes the normally thick mucus inside the cervix to thin out. Estrogen also triggers other hormones to cause one of the ovaries to release an egg. This process is called ovulation. If a woman has sex during this time, a man's reproductive cells, called sperm, can pass through the thinner mucus to fertilize an egg. In the uterus, estrogen causes the lining to thicken, which prepares it to receive a fertilized egg. Rising progesterone levels cause glands in the lining to release fluid that feeds the fertilized egg. Progesterone also causes the thinned-out mucus in the cervix to become thick again, which prevents sperm from passing through. If an egg hasn't been fertilized, the levels of both estrogen and progesterone begin to fall. This drop in hormone levels causes menstruation, a process where the uterus sheds its inner tissue lining and blood through the vagina. Birth control pills are medications that a woman takes every day to prevent pregnancy. The most common and effective type of birth control pill is a combination pill. It contains both estrogen and progestin, which is a man-made hormone similar to progesterone. The estrogen and progestin from the pill maintain constant levels of these hormones in the body. These levels prevent the body from releasing similar hormones that cause ovulation. Without ovulation, there is no egg available for fertilization, so a woman can't get pregnant. Progestin also prevents pregnancy by keeping the mucus in the cervix thick enough so sperm can't get through it. A third effect of progestin on pregnancy involves its influence on the lining of the uterus. In contrast to natural progesterone, progestin is slightly different chemically. Over time, it makes the uterine lining thinner instead of thicker. As a result, if fertilization of an egg does take place, the lining may be too thin for it to stay in the uterus, so it passes out of the body with the next menstrual period. Combination pills usually come in 28-day packs. Depending on the brand of pill, the first 21 to 24 pills are active pills because they contain hormones. The last 4 to 7 pills are inactive or reminder pills that don't contain any hormones. Inactive pills allow the hormone levels in the body to drop so that bleeding during the menstrual cycle can occur. Even though the inactive pills don't contain any hormones, the woman remains protected against pregnancy during this time. Inactive pills are also called reminder pills because they keep a woman in the habit of taking a birth control pill every day. Progestin-only pills, or mini pills, only contain progestin. Like the combination pill, The progestin in the progestin-only pills prevents pregnancy by preventing ovulation, thickening cervical mucus, and thinning out the lining of the uterus. Women may choose progestin-only pills if they can't tolerate the estrogen in combination pills due to side effects or other medical reasons. All progestin-only pills are active. Menstrual bleeding with progestin-only pills may occur once every month, on and off throughout the month, or there may be no bleeding at all. For the highest protection against pregnancy, it is important to take progestin-only pills at the same time every day. Both combination and progestin-only birth control pills are about 99% effective at preventing pregnancy if used correctly. This means about 1 out of 100 women will become pregnant each year if they use them correctly every day. However, they are only about 92% effective with typical use, which means about 8 out of 100 women will become pregnant each year if they don't always remember to take them every day.
That was amazing. That was amazing.
Thank you. Some
I'm
of my
impressed.
best work.
I'm impressed. And not only do you have a film, Progesterone, but you have your own novel, your own book, written, edited, everything by you.
By me only.
Progesterone and maternal behavior. Everybody, go get a copy. Go to Barnes & Noble. Go to Amazon. Get yourself a book. Gold lining, real leather bound. You can't beat this. Progesterone, would you mind just talking to our viewers a little bit about the content of your book?
Of course. So, as you know, my levels of progesterone are affected in the body. And I do so many things. There's so many diseases out there. I affect them directly. Low levels of me in women can cause migraines, mood changes, such as anxiety or depression, irregular menstrual cycles, endometriosis, polycystic ovary syndrome, polycystic ovary disease, and in men, low quality sperm.
Oh my God.
That's why taking care of your body can keep me in check. See your doctor today for options such as hormone therapy and ways to promote progesterone levels in your body.
Come get this book, people. It's really going to help you. Progesterone, I'm going to thank you so much for sharing.
Thank you. Thank you so much,
Oh
Wendy,
my
for
God.
having me.
Come back.
You're so
Anytime.
great. Oh my
Anytime.
God.
The best hottest hormone, everybody. Thank you very much.
Thank
And then
you.
watch the Wendy K Show every Friday, 2 o'clock.